It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our first guest today, Dr. Ken Nishino, primary care physician at Overlake Hospital. He's going to be talking about medication management for seniors. This is certainly something, Shannon, that is very important. A lot of people taking medications, a lot of people indoors not getting out to see physicians or pharmacists, so critically important right now.
Well, critically important. It can be so confusing. Some of our seniors take multiple medications. They have to be very careful not to take too much, too little, or take different things at different times. And Dr. Nishino is a geriatric specialist. He works with that population, helping them to understand medication usage.
Here's Dr. Nishino and Shannon O'Kelly.
Dr. Nishino, hi, how are you?
Good, thank you. Thanks for having me on. We're excited to be here.
We're excited to have you. We're excited to have you back, actually. The last time you and I talked, we talked about a very important topic, and I if I remember right, that was falls in the elderly population and just how prevalent they are and how concerning it can be when someone starts falling. But today, we want to talk about kind of senior management, mostly from a medication standpoint. Before we get into that, you are an internal medicine physician with Overlake Hospital. You also specialize in geriatric medicine, and I think that's a topic or a word that I think we really need to define for our listeners again, your specialization working with the geriatric population. So tell us about your background, your training. I can just tell after our last conversation, even talking to you today, you're very good at your craft. I can just feel your energy and passion towards your patients. But tell us about geriatric medicine, if you will.
Yeah, thank you for that. Yeah, well, I'm a geriatrician. We're doctors that specialize in older folks, basically. We think of ourselves as the opposite end of the spectrum from a pediatrician. As far as my background, I did my medical training at Baylor College of Medicine in Houston, Texas, and I did my medical school and internal medicine residency there. I got very interested in taking care of seniors. That requires an additional training called a fellowship training. And for that, I went to the University of Hawaii in Honolulu. They have a very big program there for this training, and I went there. I had a really good educational experience there. I wound up settling down there and practiced there for 11 years before moving here about 5 years ago.
Okay, so I'm just curious. It's good to have folks like yourself providing care to that population that sometimes, just kind of falls through the cracks. And I want to talk about something real quick here. We're going through this pandemic, and I have a 90-year-old father. I have a 90-year-old father myself, and he's healthy. He's very healthy, but this pandemic has been a struggle. It's a struggle. I mean, they're isolated. They don't have connectivity to family. And, sometimes it's just nice for family members to be able to check in on mom or dad or uncle or aunt, particularly when they need just a little bit of help. And sometimes these people are on multiple medications, and it can be dangerous if they get confused or get them mixed up. And, I just can imagine that it's been a challenge for families to connect with their loved ones during this pandemic and the isolations for the elderly people and the lack of socialization. Even if you're in an assisted living community, you can't. It's just been crazy. It's been crazy. Let's talk about that.
Totally agree. I think this pandemic has just been so hard for everybody, of course, but especially for our seniors. Just being in lockdown and just, like you said, the lack of socialization has been just very detrimental to the physical health as well as mental health, and those are intertwined. So it's just been a very difficult situation. Also with children trying to help their elderly parents, sometimes if the parent is in an assisted living facility, sometimes they have, understandably very strict policies in place for visitation, whereas they used to be able to come in and help out with the medications and other things. Now they're having to try to do this, remotely, which is extremely difficult, for some of our seniors to navigate the technology. So just a lot of barriers there, and just a lot of people feeling lonely and isolated. So it's been really tough. The recent, the CDC recommendation that once people are vaccinated, they can, have a little bit, if as long as the other people that are visiting them are vaccinated as well, they can have a little bit more freedom there. That's really, really exciting for us this week that we heard that. So hopefully there's some hope there.
Yeah, some hope is there. I mean, I feel like I'm excited. I mean, I'm encouraged. The light is at the end of the tunnel. CDC just came out with those recommendations that if you're vaccinated, that is exciting for of families. That is so exciting. I'm
Oh, yeah.
on the news. Yeah, you're just seeing people on the news like finally hugging their mom after a year.
Mm-hmm.
We need to take a short break here, but when we come back, I want to pick your brain on just how you can manage and help mom or dad manage their medication. Okay, we're going to come back just in a few. Okay.
Okay.
More with Dr. Ken Nishino and Shannon O'Kelly next on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
We continue our conversation with Dr. Ken Nishino and Shannon O'Kelly.
Dr. Nishino, again, thank you so much for joining us again here on Como Health Talk. We're talking about your field of expertise, and that's the geriatric population. And we want to talk about medication management and how important that is. Why don't you tell us everything about medication management in the senior population?
Well, it can be very challenging because a lot of our elderly patients have chronic medical conditions, and due to that, they have to take more medication. So as the years go by, medications kind of add up, and before you know it, you have 8, 9, 10, even more medications to take a day. So it can be very challenging to keep all those medications straight. Of course, the more medications you have in the mix, there's more chance of drugs interacting with each other and causing more problems. So, I think one of the main things that we really advise our patients and their families to try to do is to get a pill box.
Right.
And these are really, it's low tech. It's not as exciting as a new app on the phone or something, but basically having a pill box. A lot of these are really nicely designed with multiple dosings, per day that you can set up. So, sometimes for these, like, for example, if a son can't visit the mom too often, maybe once a week they can drop by, they can go in there and fill their mom's pill box, make sure all the medications are lined up for the week, and then during the week they can call and say, hey, Mom, how did you take your pills? And if they don't remember, they can look at the pill box and say, hey, actually Monday afternoon you didn't take this one here, what's going on? So then this is a really nice way that you can, remotely monitor the medications and make sure that they're taking them correctly. That's a huge thing for us, is to make sure that people are taking their medications correctly. It can be a really big endeavor to try to, with that many medications, and then you have, people that are a little bit more forgetful sometimes, and maybe need a little bit more help. It's just a big challenge, but that's a huge one for us with the pill box.
When you can pick those pill boxes up in any pharmacy, I would imagine.
That's right. Yep.
Right, and they're divided into two compartments. You have Sunday AM, Sunday PM, Monday AM, Monday PM. I think it's important to talk about the medication and not missing the medication. There are certain medications that they should not miss.
Absolutely. Yeah, some of these medications, a big one for us. Some people may have, like, for example, an irregular rhythm. Oftentimes these patients have to take strong blood thinners to protect them from strokes. But, there's very little margin for error with these medications. If you take too much of the blood thinner, gosh, you could have a very serious, even fatal bleed. And then if you don't take enough of it, you miss some doses, that leaves them open for possible stroke, which can be devastating. So with these medications, we just have to really stay on top of it. It's a huge task, but it's possible with a lot of people helping. I think a really important thing is to make sure you're on the same page with the physician, with your provider. Make sure you understand what you're taking the medications for. I'm always surprised when people come in and they're not, they're taking the medications, but they're not quite sure what they're taking it for. I think that's the opportunity to tell them, this is what it's for. This is why it's so important. And that's a really big part of the medication management.
Well, there you go. Everything you need to know about medication management, particularly in our senior population. Dr. Nishino, thank you again for your time and great information. Look forward to having you back again next time. But thank you.
You're very welcome. Thanks for having me.
All right, we've been talking about the primary care right now for seniors during the pandemic and management of medication with Dr. Ken Nishino and Shannon. We talked at the very top of this about how important it is. I mean, any of us can get confused if you have a couple of different multiple medications.
Yeah, absolutely. And it's so important that you understand what you're taking, when to take it, how to take it, and get the family involved to help and support.
Absolutely, and that's great advice, too. Get the family involved. Overlakehospital.org if you'd like to get more information. We have our next guest coming up right after this on Como.